Welcome to the Healers Café, conversations on health and healing with Manon Bolliger, a retired and deregistered naturopathic physician with 30 plus years of experience. Here you will discover engaging and informative conversations between experienced healers, covering all aspects of healing, the personal journey, the journey of the practitioner, and the amazing possibilities for our own body and spirit.
So welcome to the Healers Café. And today I have with me Dr. Aimie Apigian, and she's a double board certified medical physician in both preventative and addiction medicine, and holds double master degrees in biochemistry and in public health. She's the leading medical expert on addressing stored trauma in the body through her signature model and methodology, the biology of trauma. And let me see, I think I'm going to leave it for the intro. There's plenty more, but I would rather just welcome you and maybe say a few words of anything I've missed on that. But what an honor to have you here.
Thank you, Dr. M. I'm really looking forward to our conversation and giving hope and tools for people.
Yes, I think that's really what it's about, because it's easy. You know, we're always on both sides of the equation if we're a doctor.
Always.
Or
always.
But, you know, what we look for are, if this doesn't work, is there more? Is there another approach? Is there something else that, you know, could help? Now, I thought I'd go right into it and ask you, you know, Peter Levine, which I'm sure you've heard well about, he writes, human responses to treat are primarily instinctive and biological. This is in treating trauma, and secondarily psychological and cognitive. That's his approach to trauma, or his vision of how he sees that. Are we on the same page? Is there more, anything different?
Yes, yes, and or maybe no, and however you want to look at that. So Dr. Peter Levine has been someone who's changed my life personally. I have so much respect for him and what he has brought to the field of trauma therapy. And I remember when I was at my lowest, I had just been coming out of my time with my son, who I adopted when he was 5, got him as a foster child when he was 4. And everything that I just knew would help him was not doing anything to help him, Dr. M. We were stuck, and we were at a real all-time low. And then I went into my own health crash. And so when you talk about, you know, us being patients as well, yes, I have been there, and I have had to figure out what to do when what I had as resources were not working. And so one of those pieces that came to me was Peter Levine. And when I was at a place then, when I was coming out of general surgery residency, and I knew that I wanted to dedicate my career towards attachment and trauma and addictions and really finding more solutions for people, then he was one of the first places that I landed. And his view and understanding of the biology was refreshing for me as a medical physician, right? Because that I can work with.
Right.
And from what I could see with my experience with my son, but then also myself, I could see that it was biological. To me, that was clear. And what are the tools, right? Because when we're told that it's psychological, the tool is we'll go see a therapist and talk about it.
Yeah.
And so when the problem is biological, it still left me then with, okay, what do I do about that though? And to bring that point home, I really also like to emphasize the adverse childhood experiences study, because that shows in real life how something that happened in our childhood became our biology, so that we're getting diagnosed with diseases when we are adult, decades later. That's not psychological. Yes, there is a psychological component because they have, belief systems and self-criticism and judgment and shame and all of that. And yet there's such strong implications for it being biology that it is driving disease. But still, what do we do about it, right, Dr. M? Like, what do we do about that? Like, how can we change that? Because otherwise people are taking their ACE score, taking that ACE study and giving themselves a score and being like, well, I'm predestined to all of these diseases then as an adult. And I come at it from the angle of, how can I get off that path? Because that's the path that I was on. That was my health crash, where all of those conditions, symptoms, diagnoses that are associated with the ACE study. So this idea that Peter brought to the trauma field of it's biological, I could not agree more with. And his process of working with the body has been a beautiful one, which is why I've gone and been trained with him. So I started attending every talk that he did. And now I've gone through a lot of the somatic experiencing training myself and just got back from a wonderful week with him in Arizona. And his process of working with the body is beautiful. It's amazing to see that happen in real time. And where I started experiencing something that took, for me, that it kind of took that, and then I'm looking at the next level for that is, how can I leverage our biology to increase the capacity of the body to be available for therapy, to be available for healing? And what I found is that there's so much that we can do. And this is where I get super excited, because there's so many tools that we can bring in that will help either get a person unstuck in their therapy process or their healing journey, or even be able to accelerate the healing journey. So I don't know about you, but I am a person who would prefer to not spend their whole life in therapy.
Absolutely. And it's interesting because that's a little bit, in my practice too. There's nothing like getting out there and starting and seeing that there's patterns and
yes, the patterns.
And it's like, wait a minute here, this can't work. Talk therapy can't be the only thing on the planet here, because
right.
These patients were coming back and almost addicted to the same thing that they were doing and not getting better. And then I would just put my hands on them and things shifted. And it's like, why? Because I didn't know why at the time. But it's like, there's got to be more. So anyway, I appreciate also the wander, not wondering, but the wonder of how life presents itself to us always.
Yes. And I love that you say it in that way, because it is presenting things to us. It's always presenting an opportunity for healing. It's always presenting for us that invitation to just take the next best step towards our healing self and away from our trauma self. Always. Life is always giving us that. And it's whether we recognize it, or if you're like me, who needs to go, hit a rock bottom low with your health until you're willing to stop and listen to the message that your body is giving you. Either way, right? Like life will take you there in order to present that opportunity to you. And as I started working with my own system through my somatic experiencing training, I recognized that talking about patterns that you just mentioned, Dr. M, I kept going into the pattern of the freeze response in the middle of trainings. I'm here with somatic experiencing people. I'm doing the training and I'm going into the freeze response while I'm in the training. And I'm realizing, oh, wait a second, like my biology is already so close to overwhelm that it doesn't take much to just top it over. And so that's where I really started looking at, what are the biology things that I can influence in order to help myself through this experience, so that I can even attend the trainings and not be fighting my freeze response this much.
Yeah.
And one of the things that has come out of that is what I call the biology of trauma. And so this is now a training that I offer providers and practitioners so that they can learn not only the biology that is a downstream effect of trauma, but then how we can use biology to make the body more available. And when we look at that freeze response specifically, and I'm going to assume that your audience knows that terminology. Yeah, more or less. Yeah. 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 So overwhelm, trauma response, the freeze response. And when I realized that the trauma, that freeze and trauma response is an energy problem, if the body had more energy, it wouldn't go into the freeze response. It'd be able to stay in the sympathetic response and have an active response to the threat. And then I started thinking, well, what are the things that are draining my energy in my body? Oh, well, I've got inflammation. I did some lab testing, and I've got high copper to zinc ratio. That's actually a neurotoxin. If I have a neurotoxin, my nervous system is already on edge. It has a lower capacity for stress, which means what I call just like a higher pull towards that freeze response. I almost feel it as if, like it does. It feels heavy when you go into the freeze response. So I always feel like it's this like rope that's like pulling me into the freeze response. And it's like, wait a second, I can identify some of these neurotoxins, some of these things that are draining the energy of my nervous system. And by addressing those, I now have more capacity to stay present for something than what it would otherwise have done, and has done my whole life, of continue the pattern of just, oh, that's too much for me. I need to check out. Oh, that's too much for me. And there I go into my freeze response. Oh, that's too much for me. I'm going to stay here physically with you, but in my mind, I am somewhere else. I'm not even hearing this conversation. And so by being able to now teach this to other practitioners in my training course, of there is this biology of trauma. And this is actually like not just the somatic experiencing exercises, though those are essential, and I incorporate those into the work that I do, but it's also how can we identify the biology that is almost predisposing someone to ongoing stress and to the freeze response. And just with that, like the difference in my life of what I've been able to accomplish in my own system has been literally life-changing for me, because everything before felt like it was so much and it was too much. And so for me to now be able to navigate life's problems, because life doesn't stop giving us challenges. Don't know about you, Dr. M, but life keeps bringing us challenges. I now have the ability to change that pattern that I've always had, to just go into the freeze response and be like, this is too much for me, because I've been able to work with my biology.
Yeah. Well, I'm pleasantly surprised to hear, just because, the way education is, not the journey of an individual physician. That is completely, up, in a sense, up to them. But, when there's almost no nutrition taught in medical schools, then it's like, how do you come up with that? How do you, even entertain, things
Exactly.
like N-acetylcysteine or magnesium, or the role of, it's like, where did you pick that up? And it's like, yeah, that's exciting, because I do think there is, I agree with you, there is that piece. And then we can also work with the parasympathetic system, and the multitude of ways that we can change the body's ability to calm the autonomic nervous system. But if you're missing substrates, or you're in a toxic condition, like copper, as you mentioned, you're limited. So
very limited. And I think that we've really done a disservice to people by teaching them that your emotions are up here and over here. And we even want to say, mental health, or your psychology, or just call it your emotions, and separate that from your physiology, from your biology, because every emotion is actually a specific biology. It's just, that's how it presents itself. That's your experience of your biology. And so, yeah, when you have the deficiencies, when you have brain inflammation, neuroinflammation, when you have any of those things, right? Like, how can you expect to have your nervous system and thus your emotional state in a good place? It's going to be in a either stressed out or in that overwhelmed state because of how long it's needed to be maintaining that danger response.
Yeah. And you know, the other thing too, like neurotransmitters
Yes.
are in the gut. Like if we don't
Right.
know the first thing about it, you know, the gut, then you have, like you say, an inflamed, or what's that called? What's the cool word that everyone uses?
The leaky gut.
That's it.
Leaky gut, the intestinal permeability. Mm-hmm.
But you know, it's like you're not going to build what you need.
No, not at all.
And it's like so much of the approach available is, oh, well, we'll just play more chemicals with your brain. Based on what?
Right.
Yeah.
And this is where I see many people who experience a temporary relief when they're doing a therapy, right? And whether that therapy is going to yoga, or they're doing a daily meditation, or they're going to a session with a therapist, and they may experience a temporary relief, but then they fall back into those same patterns, either an hour later, a day later, whatever it is. And it's like, well, yeah, because your biology is not able to sustain that.
Yeah.
And so just as important as doing those things, I'm not saying that those things are not important. I'm just saying that if you really want to maintain the changes and the shifts in your nervous system, we have to, it's not an option. We have to be looking at your biology and how to maintain those shifts. And this is really the neuroplasticity of the nervous system, right? Because a temporary shift is not a change in neuroplasticity. A change in neuroplasticity is something where a shift has happened that is still there a month from now, 3 months from now. That's neuroplasticity. And so that's what we want to be building in order to really truly come out and change the patterns, the bracing patterns, the guarding patterns, the reactivity patterns that we've likely had for most of our life from our childhood.
Well, we're definitely on the same page there.
Yes, we are, Dr. M. Yes, we are. And we'll keep preaching it, right?
Yeah, no, but I also, so in your let me just see here, I wrote some notes that I wanted to make sure I ask you. What's it, my page has frozen.
No, your page went into the freeze response. Oh no. Bad timing. That, that's been my freeze response too. Like, it just has the worst timing in the most crucial conversations, right? Like, that's when my freeze response will show up, and it's like, no, not now.
Yeah, so you mentioned here that all aspects of biology of trauma, this is part of the message you want to share. So anything about that, but I also want to specifically how to address the effects of stored trauma on the biology. So is there anything, and then you make note of the immune system, the mitochondria, cortisol. Is there anything, so how do you approach that? Like, let's say that I'm a traumatized patient coming to,
like everyone else in the world right now
at this point. Yes.
Yeah, sounds about right.
I think absolutely that's the main thing right now.
Yeah, and whether you want to call it traumatized or whether you just want to recognize it as fear, right? Fear and insecurity.
Sure, but it's also, I don't know about you, but for me, people who have experienced trauma in the past are being massively
re-traumatized. Yeah.
And re-traumatized now, which is, I mean, it makes total sense.
Yeah.
But yeah, there's a lot of it. Anyway, go on. I don't mean to distract from the point.
No, this isn't distracting at all. So, probably what comes to mind, first of all, is the recent conversations that I've been having with Stephen Porges. And he says over and over again, and thankfully his work has now been permeating the trauma space as well, where all therapy, all healing, all, no exceptions, all is based on a felt sense of safety.
Manon Bolliger here, and I want to thank you for taking actionable steps towards engaging your healing journey and helping others discover their path by watching, sharing, subscribing, and reviewing these podcasts. Every review and share helps spread the word, these different perspectives and choices and options for healing. And to thank you, I'd like to invite you to sign up to my free 7-sequence email tips on health and healing for everyday life. You can go to healerscafe.com tips. Thanks so much. Yeah.
And this is where, for me, the biology of trauma really gets to come in and show how we can facilitate that. Because for most people, Dr. M, and you let me know if you think otherwise, I think that many people try to tell themselves that they are safe, but it is not a felt sense in their body.
No,
They probably don't even know what that feels like in their body.
yeah.
Right?
No, I completely agree. And because part of the work I do, I use a methodology that I've shifted, made useful to me and really incorporated with the trauma work I do. But it's based on a fellow named Tom Bowen. So it's called Bowen therapy, like Bowen. Anyway, but one of the reasons I do this, it's also good for pain, for all kinds of other things. Yeah. You don't have to focus on trauma. You just focus on the feeling good of the entire body, And it's amazing in that. Yeah. Like when I start with people, I can see that now they're able to finally relax. Maybe the first time they're still, wondering what's going to happen. And this is it's so gentle that you're in and out of the room. It's not like heavy duty, presence, but that's what the first key that I know that they're on the mend is that they feel secure in their body, and then their connection to others changes, right?
Yeah,
and
we can only connect with others when we feel safe and secure in our own body, because otherwise it's our biology. We are designed to be on guard and be in survival mode if we don't feel that safety and security. And so literally the focus is all on ourselves. There's no way we can change that. We can, people try to outthink that, but that's not something that you can outthink. Like, your nervous system does drive your life.
Yeah.
And so, having that, being able to shift that into that place of security and safety, like you're saying, is essential for us to even be able to notice other people and what state they are in. And sometimes they're in a state that would normally trigger us, right? If we see them lonely, if we see them sad, if we see them grieving, if we see them angry, for some of us, like, ooh, that would normally be a trigger. And only can we let ourselves see that and not be triggered and pulled back into our trauma response if we are feeling safe and secure in our own bodies in that moment.
Yeah. No, I totally agree with you. Yeah.
Awesome. So with the biology of trauma then, and that feeling of safety, this is where we get to play around with a word that's called interoception. And interoception refers to the vagus nerve, and the 80% of communication that happens in the vagus nerve that goes from the gut, from your visceral, which is your organs and your tissues, back up to your brain. So more communication is going from your systems, from your organs, back up to your brain than is coming down to tell them what to do. And that is where we get our felt sense of everything, our felt sense of our environment, our felt sense of our safety, our security. And so when we talk about a gut feeling, like, that's a real thing. Our intuition is our gut feeling. And that gut feeling is, ooh, like my vagus nerve is sensing, danger or bracing or something. And so this is where, kind of coming back to your point around the gut, just looking at the gut, we're not even looking at other aspects of your biology right now, but just looking at your gut and all of the things that are there and how are they influencing the messaging and that felt sense of your gut and it communicating to your brain. For most people now, it's always communicating a baseline of danger because of the things that we're ingesting and the inflammation that it causes, or the changes in the microbiome that it causes, the neurohormones and how that's going to change those expressions, the changes in the neurotransmitters, if that's going to change whether there's inflammation or a change in the microbiome. So all of this stuff that's happening in the periphery of our body is coming back up to our brain and informing us that regardless of our external environment, our internal environment is one of danger. So how do you expect to have a felt sense of safety if your biology is what's communicating danger? And so this is where it's like, hey, you can do all the therapy you want, right? You can do all the therapy you want, but when you walk out of the therapist's office, if you still have gut inflammation from the ice cream that you ate yesterday because you were feeling lonely, hey, like that's going to be communicating a felt sense of danger, and your nervous system is going to go right back into those patterns of coming from a place of insecurity. And I don't know if I'm going to be okay. I don't know if you're safe to trust. I don't know. And so with that comes all of the guarding, the bracing, all of those patterns that we work with in somatic experiencing. So this is where the body work that you do, right? Like the body work and the biology, they have to go hand in hand for someone to experience the shifts and maintain them.
Yeah. No, I think to me, they come first, because a patient may want to talk about their negative thoughts or the story that they believe to be true or re-emphasized or, reconfigured to make sense of their life. And it's very tempting to spend time there. But it's like, I often say, well, let's see how your body is doing first. And then it's incredible how many times they'll say, well, yeah, whatever, it's up there. It's like, they don't need this anymore. It doesn't actually, it's not required anymore. It's very interesting. Yeah.
Yes. And, from the work that you do, right? Like you know that we have to go at the pace that the body is ready for.
Absolutely. And it won't go any faster than what it's ready
for.
It
won't go any faster, no matter how much you push and pull and poke and anything. We have to go at the pace that the body is ready. However, what if we could come in and through the biology, provide the support that it needed to be able to safely go faster?
Well, you need the biology.
You have to have the biology.
I totally agree. That's so typically then, back to me coming to visit you, you would sort of see, like you would do a full testing of actually what type of testing would you then do? Because there really isn't anything in common medicine, right? What do you do?
What do you do? I hear you asking that, Dr. M. All right. I'll share. Because right, you go to a hospital, a regular physician, and they're like, let's take an x-ray, let's do an MRI, let's do blood tests. It's like, wait a second, what do you do? How do you find that stored trauma in the body? So I start with a bunch of assessments, and I'm assessing people for their physical health, because there's talking about patterns, right? There are specific patterns that show up in one's physical health that tell me what their biology is underlying that. And I'm always looking for just what's the next best step for us. I'm not necessarily looking for the whole path and the whole journey. I'm looking for what are those big boulders right now that are blocking us from being able to move faster or even move at all if a person has gotten stuck. And so many times, Dr. M, when we find those, I want to call them low-hanging fruit, right? When we find those big boulders and we're able to move those out of the way, so many other things fall into place. And so this is why I actually do not start with testing, with lab testing, Because if I were to test somebody, I would find almost everything wrong, right?
Right.
And then it's like, well, then where do you start? And that's what a lot of functional medicine practitioners do. They start with all of this testing, cost you about $1,000 or more to do all of this testing, everything from, you know, your blood to your urine to your poop, everything, hair sometimes too. Why don't we throw that in? And then they come back and they're like this super long list of everything that they found was wrong. How overwhelming, how traumatizing.
Very
So very traumatizing. And then they put you on a supplement list that's about 2 pages long too. And your digestive system can't even handle it.
Oh,
So
I have glad you're sharing that because no, that's true. That's the other extreme, right?
It
Like
is.
people in the know, like naturopathic doctors, of which I was, or these functional medical doctors. It's kind of the same. That's what it's like. Well, just because we know it's related doesn't mean you have to make a cocktail of it, you know?
Right. And
Yeah.
what I have found is that, again, when I can find the big boulders and I can move those out of the way, it just allows the body to have more space and energy to then fix itself with a lot of these other things. And so a lot of those other things fall away
Yeah.
and we never even needed to address them.
Yeah.
And so I am doing the assessments to find those big boulders.
Mhm.
And I'm looking at a couple different things. I'm looking at your immune system because that can be a big boulder, right? And whether the immune system problems came first, it's not usually the case, but in a rare case, it's more often that the trauma caused the imbalances in the nerve, in the immune system, but now they are there and they're keeping the nervous system stuck. The primed microglia is a big one. People who have had any kind of a head injury, even as small as a whiplash,
Yeah.
they have this neuroinflammation that can get triggered with everything from emotional stress to food sensitivities to not getting enough sleep at night. And so all of a sudden they're back in brain fog and anxiety and depression and what feels like the freeze response, and it's actually activated microglia. So that's a big boulder that I'm looking and assessing for. Is that a piece of the puzzle here? There are 3 most common biochemical imbalances I have found that consistently across the board, everyone who's challenged with stress or overwhelm and burnout or chronic fatigue, chronic pain, they've got at least one of these. I had all 3 of them. So they are the most common ones. And so more often than not, I'm also making that be one of my first recommendations and one of our first next best steps. But I'm not jumping there immediately. I'm doing assessments because those have common traits and characteristics of people who have those common biochemical imbalances. I'm also looking at attachment and neurodevelopment.
Mm-hmm. Okay.
And this is a piece that is not in medicine yet, but I have found essential. And so I am doing assessments to find what, not only, I'm not actually looking at what their attachment style is. I'm looking to see what are the core beliefs that they hold coming out of their childhood that tell me whether they had a gap in a neurodevelopment level, either like 0 to 6 months of life or 6 to 18 months of life, because that would have affected their neurodevelopment as well.
Yeah.
And whether their neurodevelopment issues happened and that caused the insecure attachment, or whether the insecure attachment caused the neurodevelopment issues, it's at the end of the day, they're both here. And so we have work to do. And so this is where I'm bringing in reorganization of that neurodevelopment. And so having them get on the floor, for example, get on their tummy. I have them take a video of them doing a tummy time crawl. And that, Dr. M, gives me so much information about their early neurodevelopment and how that might be driving their stress, their trauma, their biology. And just by organizing that can be a huge piece for someone who had, I want to call them either an injury, which would be like an abuse, or maybe they were adopted, or maybe they had, maybe they were born premature and they had that clear separation and probably some medical procedures that would have really impacted their neurodevelopment and attachment, or if their parents just follow the normal social practices that are actually traumatizing to infants. And for that reason, they miss some things in their neurodevelopment.
Right.
And so that's an important piece to bring in for this biology piece. And so doing all of those assessments and then kind of stepping back and looking at, all right, where are the big boulders in all of this? Do we need to go for the immune system, or no? Does that seem to be, it's a problem, but it's not the biggest problem. And I think it's actually the neurodevelopment and maybe this pyroluria or the copper to zinc ratio that's off. And that's driving these problems in the immune system, as well as, of course, the problems with the nervous system and staying stuck in their stress or trauma responses.
Mm-hmm.
So that's what I would do if you came to me.
So you'd have me crawl on my stomach.
I would have you, if we were in person, I'd have you get on the floor and figure out how you're going to move your body on the floor without taking your belly button off the floor. And that right there would tell me so much information about your entire life, because when that was your neurodevelopment, when that was how your nervous system organized, those are patterns then that stick with you forever and show up in all areas of your life.
So is this something that you've come up with, or is this my ignorance of not knowing about this?
This is stuff that I have pieced together from all of my different trainings and life experiences. So the neurodevelopment piece is something that I learned about when I had my son. And as I worked with more families who were adopting children, it became a huge piece, because we were working with some, like I think about them, right? Like I feel the heaviness in my heart. Some children who were originally from China or from Romania or from Russia, and the conditions that they had as infants in those orphanages, and the gross neglect that they had. And they did not get any neurodevelopment. I mean, yes, their nervous system developed because, they're breathing, but in terms of their sensory pathways, their ability to read emotional language and body language, all of that was gone. And we had to literally rewire, or I want to say reorganize, because it never really was. It was wired for insecurity, gross insecurity from the very beginning of life. And so from my work with those extreme cases, Dr. M, like that's where I learned, oh, this neurodevelopment piece is actually really big. And it's not just those kids that were adopted from those countries and had those experiences. It was actually me. I did my own neurodevelopment program once I realized, wait a second, I have my health issues, my health conditions directly come from gaps in the midbrain neurodevelopment. I need to be on the floor. I need to reorganize a lot of that in order to change my biology.
Wow, fascinating.
Fascinating. It is
very exciting.
It is really exciting. And for me, what it's done for me is it's given me a true picture and vision of how the body really is all integrated and is one system. It's not the mind and then the body, right? Like it's just the system.
Yeah.
And it all interrelates.
Sense to me, like, and that's of course where I stand for it. But I find that your assessment tools, like your actual journey to, and the French word comes décortiquer, but I can't think of what it is, like separate out, to really understand is pretty exceptional. That's incredible. Do you have a book out yet, or?
It's supposed to happen this year, Dr. M. I need to be able to slow down enough with my certification course and training other practitioners in these methods to be able to write the book. So it'll happen.
But you do currently teach
I do.
other practitioners. Okay, well, when we put your this interview out, if you're up for it, we should put a link so people can actually find out more and learn this.
And would be very welcome to that. Like, again, like my whole thing is just bringing new tools and the hope that those new tools bring with it.
Great. Well, thank you so much for being here. I really appreciated this.
Thank you, Dr. M. Appreciate the work that you're doing.
Thank you for joining us at the Healers Café with Manon Bolliger. Continue your healing journey by visiting thehealerscafe.com and her website. and discover how to listen to your body and reboot for optimal health.